My name is Leanne and I'm an occupational therapist or an OT with the Adult Mental Health Services. So within the adult service, the role of the OT is to look at somebody's participation in occupations, activities or tasks that they find important. So our role is to look at getting someone either into new areas or new activities, or looking at re-engaging them in things that may have become a bit disrupted if a person has become unwell or has experienced mental health challenges. So your first meeting with an occupational therapist, you will do a brief initial interview, nothing to worry about, just a few questions around how you're getting on in your day-to-day life, how you're spending your time, what you find that you're doing well and what you find you may have a bit of difficulty with. And from there you would be looking at goal setting, which will hopefully reflect where you want to go in the future as your recovery progresses. A referral is made to occupational therapy when it's identified that the person is experiencing a little bit of difficulty with their activities or their daily occupations. So daily occupations would generally fall into a number of categories, things like self-care, work, education, leisure, and I suppose restorative activities that would help you to kind of cool down and get away from life stresses. So when somebody experiences a mental health difficulty, at times it can disrupt someone's participation in activities that they would have previously really enjoyed. So part of your recovery process will be getting you back to what you would like to be doing with your day. The purpose of OT within an adult mental health service is to, I suppose, get a person back to where they would like to be, or to move them forward into a new chapter of their daily lives. So how we spend our time on what we do is very often disrupted by mental ill health or by mental health challenges. And I suppose the role of the occupational therapist is really to look at, well, how could we get you to where you would like to go? It's very much focused on what's meaningful to you, the person who's coming in to see us, and it can take place in a number of different locations. So on a daily basis, I would meet people in clinic, I would meet people within their homes, and I would also meet people out and about in the community to try and get them engaged in, I suppose, community activities and get them participating outside of their home. In the Adult Mental Health Service, a referral can be made to an occupational therapist by any member of the multidisciplinary team. So if you are working with a consultant psychiatrist or a member of the medical team, with a member of nursing, psychology, social work, or any other member of the team, you can ask for a referral to the occupational therapist, or it may be suggested to you as part of your session with that team member. So I suppose when a lot of people come in to see me initially, their biggest concern is that I'm going to look at work with them and getting them a job. That's not actually the role of the occupational therapist on the team. So we typically look at 4 distinct areas. Productivity is one of them, but there are many ways of being productive. So people who stay at home and look after their families, that is a productive role. Someone who is in education, that is a productive role. Someone who cares for others, that is a productive role. So it doesn't necessarily mean employment, paid employment or volunteering. Then we would look at self-care. So what is the person doing to look after themselves physically, psychologically, emotionally, and looking at what strategies, ideas or tasks could be put in place to assist a person to increase their level of self-care. We would also look at leisure. And I suppose when someone has experienced mental health challenges, they would typically report that their leisure interests may have been one of the first things to go, as they focused on things that they had to do rather than things that they wanted to do. So we would look at providing opportunity or access to activities or to tasks or community-based resources that would enable someone to either re-engage with an old leisure interest or to start up a new one. So it's about forging the path ahead. It's not just about returning to what you did previously. And I suppose finally we would look at restorative occupations. So restoration is basically what you do to recharge the batteries to enable you to do all of the other things within your daily life. So an example of restorative activity could be something along the lines of, you know, sitting down, reading a book with a cup of tea. It doesn't have to be complicated, but I suppose the benefit of engaging in restorative occupations is that it then charges up the batteries as such to enable you to do everything else by increasing your energy levels and your motivation. I do what I do because I love working with people, and I suppose I get the really lovely part of the job, which is helping somebody get back to what it is that they want to do, or get them to a point where they can achieve what they would like to get to in the future. You get people coming in who maybe have had a bit of a difficult time, and you can work with them on the recovery journey to really push them forward and to get them to a point where they're happy with how they're living their lives.